Why is the FDA taking so long for full approval of Moderna and Pfizer?
Still, I'll tell you why. Because yes, we know that Pfizer tried to get approved on May 7th. Moderna applied for a full approval on June 1st. And I really was optimistic that we would be approved because we know that the vaccines are safe. We know they are effective. But
And some good news on the COVID front. A new study says the Pfizer and Moderna vaccines may protect you from the virus for years. The findings are further evidence those of us who have our shots may not need those boosters. And now some are calling on the FDA to move faster to fully approve the vaccines. Polling indicating that full approval could help convince some of the unvaccinated to get their shots. Some think the emergency use authorization would mean the vaccines aren't really safe enough. And joining us now is Dr. Reed Tuckson, the former health commissioner in Washington, D.C., and co-founder of the Black Coalition Against COVID, and Dr. Frita Fisher. She is the founder and president of Midtown Atlanta Nephrology. Dr. Fisher, I'll begin with you. Are we running away from the vaccine as African Americans? I mean, I can't think of a single issue in which there is more information out there. And now we're hearing concerns about the Delta variant that says if you don't get your shot, you could die. What more do doctors like you need to do?
Good, how are you doing? Good morning. What doctors like me need to do is to continue to be patient. In the beginning, I was very understanding because a lot of Black people were like, let me wait and see. I got that. But now we've had the opportunity to wait and see. We've had well over 300 million doses given. We see that the vaccinations are safe. In the beginning, there were a lot of questions about can we trust the medical community and are Black people involved? But now we've done the education. We know that a Black female, Dr. Kizzy Corbett, was one of the lead scientists to produce the Moderna vaccine. We know that Black scientists have been in the room in the advisory committees. And we also know that Black people are disproportionately affected from dying of COVID-19 and having long-term complications. And so at this point, we have only one choice. We can't get frustrated. We can't throw up our hands. We have to keep meeting patients where they are. Where they have valid concerns, we validate those concerns. We talk to them about the past. But we have to remind ourselves as Black people not to allow our tragic past to become our tragic future. So as African Americans, we definitely need to get on the boat and get these vaccinations.
Dr. Tuckson, how concerned are you about this Delta variant? Because now we are hearing from the World Health Organization, I believe it was just yesterday, put your mask back on, specifically if you live in a place where the virus is still rampant. We're talking in the United States, Alabama, Mississippi, Louisiana, parts of Georgia. Black folks should be very concerned.
There's no question we should be very concerned, and we are smart enough to be able to look at the news from around the world. We now know just in the United States alone, this new variant from India, the Delta variant, is now 21% of all of the COVID cases in the United States. That's up from only just a few weeks ago when those numbers were in the single digits. But you look now across the country, across the world, we're seeing it in not only India, but we're seeing it in Israel, we're seeing it in Australia. You're seeing it across the globe where this variant is wreaking havoc, causing countries to shut down yet again. And so we as people of color need to understand we're out there as among the most parts of our population that are unprotected. And right now, to be unprotected in the midst of this spreading variant is really, really a dangerous situation, not only for the individual, but because we as Black people tend to congregate among ourselves. So what we're going to be setting up is a cycle where we will continue to infect each other. We will then continue to die, and there will be no excuse because we were warned about this and we knew that we needed to get vaccinated, and we need to get vaccinated now.
Dr. Fisher, why is the FDA taking so long to approve this? And first of all, are they taking too long to approve it? Because after all, we're talking about millions of people who have already gotten their shots. If something was going wrong, people like me would be out here all the time talking about why didn't you tell us that this vaccine could kill somebody? Ain't nobody died. Why is the FDA taking so long for full approval of Moderna and Pfizer?
Still, I'll tell you why. Because yes, we know that Pfizer tried to get approved on May 7th. Moderna applied for a full approval on June 1st. And I really was optimistic that we would be approved because we know that the vaccines are safe. We know they are effective. But even though these COVID vaccines have been studied more than any other vaccines in history, even though we have more robust data, there is also a serious microscope on the administration, on the FDA. And so I think they're really trying to be extra careful to dot all I's, to cross all T's, because Lord forbid, if just one thing goes wrong, then that could really crash this life-saving operation. And so I think that they are being exceedingly careful, probably a bit too careful, but just to make sure that there is no doubt whatsoever once these vaccinations are fully approved. And of course, we want them to be approved because then schools and employers will be able to recommend them if they want to. We'll have physicians able to get the vaccinations without having to go through such governmental red tape. And also, some studies have shown that 32% of people between the ages of 18 and 29 say that if there is a full approval, they will be more likely to get the vaccination. And so it's taking a while, but hopefully things will go ahead and speed up because, yes, this is an urgent, emergent matter. We need the vaccinations to get out even more so than we already have.
Dr. Tuckson, I've only got 15 seconds left, but is it time to mask up again?
I would do it if I were you. I would put my mask on when I go outside, whether I'm vaccinated or not. These variants are of concern. Protect yourself. Be extra cautious.
Dr. Reed Tuckson, Dr. Frita Fisher, both of you, thanks for being with us. You're watching DC Today. We'll be right back.
Over 4 million people on Medicare made a choice to